All right, let's move on to our next question. This again comes from Instagram and it reads, "It feels like my knees are weak. Parentheses, stairs feel like a struggle and the horrible, uncomfortable feeling when I kneel. It's not a sharp pain, just major discomfort. Is it inflammation? Any tips? Thanks." Hello, thanks for that question. And you're not alone. I've had many patients over the years that have complained of this problem. Um, we all definitely experience knee issues with kneeling over time. And what happens is when we're kneeling, we're kind of squishing and squashing that kneecap into our patellar groove, which can definitely create some not very fun feelings in there. So first thing off the bat, if you've already tried a few exercises and stretches and things haven't gotten better, then I would recommend seeing your doctor or your PT. Just check things up and make sure you're ready to go before you start any new exercises. So as a PT, what I would do first is I would start stretching. So stretching your hip flexors and your quads. So your patella or your kneecap is actually embedded in your quadriceps tendon. And when your quadriceps get really tight, it can actually pull that kneecap up in the patellar groove and make it kind of ride in a not optimal position. So we want first to get those quads nice and stretched out so we can be in proper alignment for moving on. From there, we'd start with isometrics, so your quad sets, making sure your quadricep is contracting properly and slowly building up strength over time. We don't want to give you 20 exercises to do right off the bat. One, it's difficult to do all of them all in one sitting, and it can kind of deter you on your journey. So even if you start with one, it's completely fine to do. It'll actually give you a better chance of staying consistent with it and getting your muscles and your body primed and prepped to properly do the exercise. Also, it may be inflammation. It also could be another thing called patellofemoral syndrome, which is kind of a catch-all term for knee pain. And like I said earlier, it could have something to do with that kneecap not riding in the patellar groove properly, but also with some glute weakness as well. So if we've got some glute weakness, it'll tilt our hips to the side, cause our knee to cave in a little bit, causing just a little bit of a gait disturbance when you walk or do any other thing throughout the day, such as sitting, standing, kneeling down to get something. So we need to kind of look at this thing globally as if what's weak and what's tight. We want to fix what's weak, or strengthen it, and then stretch out what's tight so we can get things in optimal alignment. And after you've slowly started to do these things, you can kind of pick up the pace then and add in an exercise here or there, such as leg press or mini squats and mini lunges. Start off with a very small range of motion and then slowly work your way up into your full squat or your full lunge.